Hi, everyone, and welcome to our episode of the Crave Connection in Products podcast. I'm Adi, I'm founder of In Products and host of Crave Connection, and I'm joined by Veron Lai, who's the head of design at Accurx. Veron has experience in service and product design. She's got over 10 years experience working in health and care, and she previously worked with LV, NHS, Barnardo's, and global pharmaceutical companies. So, Veron, welcome to the In Products podcast. What a way, I think, to start a Monday morning, straight into a podcast.
Yes, absolutely. It's a very cold morning today as well. Well, thank you, Andy, so much for having me to join the podcast.
No, thanks so much. Veron was actually part of our panel discussion at our In Products meetup just last week. So I'm really pleased to have you on the podcast, Veron, and discussing the topic of changing health outcomes, which is what we discussed at our In Products meetup. And I thought this was a really nice opportunity to share those experiences, I think, which we all learned on that evening, which was, we had so much positive feedback in terms of the discussion between you and the other panelists. I think everyone agreed that we probably could have gone on for hours with those conversations.
Yes, absolutely.
Um, but for anyone, I think, who joined us on that evening, I think it's really nice to have like a recap, hear your specific opinion. But also, I think, anyone who didn't join us to really kind of be able to kind of get the benefit of the discussion we had. So, Veron, obviously, you were so kind to kind of give back to our product community and join us on the panel. So, why was it important for you to take part in a meetup and, I suppose, discuss the topic specifically?
Yeah, I think I will start talking about the topic. I thought it was, Eddie, you did a great job of like bringing different perspective on the panels. I think that was the first thing really attract me. We have like the medical's expertise, but also got the data perspective and myself representing the design perspective to really inform the ecosystem of like designing product in the digital health space. So I thought that was a very interesting panels to begin with. The other thing I thought like Meetup is fantastic. It's so accessible for everybody. And I just like having like forum that open for everybody, for people who have been working in the industry for years, but also people who are very interested to getting the industry. So I thought Meetup is just like so accessible. And I also think the space and also the number of people you brought in together was fantastic. Like people stay behind, have a chat. So I felt like the more conversations we can actually connect people together, the better that the industry will become.
Yeah, absolutely. I think it was so lovely to have a mixed like panel of experiences, because I think even the people who the questions, I suppose, even if they were aimed at design, I think that people who weren't working in design had an opinion on that. And I think that that's like the real importance of it, is not just channeling into one specific area of this, getting an overall opinion from different people working in the health space. And I'm really, really pleased that you enjoyed the evening. I think it's
Yeah.
exactly what I love about hosting product meetups, like bringing together 50 people where it's super casual. You get to the end of the evening and you're having to kind of like exit people out because they're enjoying themselves too.
Yeah. I think I stayed for another like hour and a half or almost 2 hours. And it was just so nice to like chatting with everyone. People are very engaged and also have follow-up questions. But also like some people connect with their own disciplines. And I can see the audience, there are people working in the healthcare space. They are like healthcare professionals. And you also have like designer, product managers. And what's also interesting, I met quite a few individuals who are healthcare professional by training by background and then now working in the product space. So I just think like this is brilliant. That is what the diversity of the industry we need to see, to have people from different backgrounds and then all working and like transferring to different skills, to looking at like what is the product and what is the realities and like how can we connect all these people together. And I think that is exactly where the healthcare space needs to see ourselves on like bringing the diversities together. So yeah, it's fantastic.
Yeah, I also met some people who were working in purely in the medical space, looking to transition into product, and that was
Yeah.
really interesting. I think in terms of the advice that they got from the evening on how to make that transition. So,
Yeah.
in terms of the questions which we're going to ask today, we're going to go through, I suppose, kind of a similar kind of path to what we did on that panel, and just really kind of like delve into those questions in a little bit more detail. So, Obviously, the topic was around changing health outcomes and a real focus on that medication versus digital product. So in terms of, I suppose, the gaps which we're seeing in our health ecosystem that could be filled through digital products, where do you think those kind of, like, for you personally, where do you see those main gaps?
Yeah, I think it's a very, very good questions about like where the gaps on the space of healthcare. I think if we're looking at just healthcare in the UK, the system is quite fragmented. I think in one side, from what I have seen since I started 10 years ago, you got one side is looking at how the transformations on larger organizations like scales and change, and they consider as like digital transformation. So you're looking at it from like the NHS perspective, but then at the same time, you also got like pharmaceutical companies like trying to looking at digital transformations, as in like how they can use digital to do things quicker and better. But then at the same time, what are the other sides is on the consumer side? You can see like startup looking at like different ways to hack into the industry. And so what have been happening, I can see in the last 10 years is that the industry is moving forward, but in a very different pace and scale. So you got the consumer side is definitely the amount of interest, the investment, and you're looking at big players like Google, Amazon, like all investing in different sort of healthcare initiative. And then you also got like newcomers like Headspace and Soyin, you name it, like to come into the industry. And a couple of companies I worked with before, Elfie, like a company that's less than 10 years old, and they're like all entering in the space of healthcare. And then at the same time, you also got the large organization in the public health space is like looking into how they can resolve these digital transformations, trying to looking at like integrations of different systems. So all of these are moving in their own way and different pace. But the problems that I can see looking back in the last 10 years is all these different part of the moving parts, if you like, they are
Yeah.
not really integrate together. And if in order to understand like one individuals like us as a patient or as a citizen, like our health, you can't looking at it in silo. You kind of want to build the pictures on like what does it really look like, how different parts of the players can support each other. I think that is the gap that we are at in this ecosystem that is still fermented, but in a different ways because all the different parts are trying to move forward in their own way and own pace. But fundamentally, is this incentive of like how they can connect together. I think that is where we probably looking at more in the future about data and policy change and all that, how they all can play a part together.
Yeah, it's so interesting. I think, like you say, just having those different like bodies, but also different like stages of business who are all trying to support people's health, but have such different problems when you
Yes.
kind of like really delve into it. I think that's so interesting with your experience, having worked like in NHS, Bernardo's, startups, like pharmaceutical companies. It just gives you that like overall picture, which I think is so beneficial. I mean, in terms of like breaking that down, and I suppose if you are like in working in kind of product, working in health tech at the moment, how do you think that you like identify, sorry, those gaps which you feel like could be benefited through digital product? Like, what kind of like process to really break it down do you think that people could like think about or use to really find those gaps which could benefit their specific business, whether they're working in like the NHS or working in a startup, for example? Is there any kind of common themes which they could look at?
Yeah, I think what I find really interesting that have been an echoing theme for myself working in different parts from like pharmaceuticals to like public health to now being a suppliers to the NHS as well is looking at the context on like the wider systems of like how your product play a part in terms of the peoples that you're designing for and with. I think that has been quite a useful way to framing what is the problem to look at. Because the system is so big, sometimes like as a companies or as a designers or product managers, like you kind of quite overwhelmed with like all these different perspective of like, oh, am I looking at a problem that is small enough that I can contain and actually create something meaningful? But then at the same time, it's like, oh, but if I don't understand the wider structure of like how this is happening in the first place, I'm not going to create anything to truly resolve the problem. So I guess like the starting points could be quite a useful way to framing it is like what is the context that you're designing for, and then at the same time understand like how the different parts plays together. I think this is quite important because often what I have seen in the past is like even from pharmaceuticals and also like children's social care as well, like very often when we solve the problems, like the root cause of the issue is lies elsewhere. So
Yeah.
if you're just looking at the symptoms of the problem, you're not able to like resolve the core and the root of the issue. So interestingly, it's so relevant in the space of healthcare. If you're thinking about if you're treating the symptoms, didn't treat the root cause of
Yeah.
your health conditions, you're not able to resolve it. And I think like this view of looking at designing products and designing for healthcare is so relevant on like, are we actually looking at the problem of the root of the issues and who
Mm.
are the players that actually have influence or the factors contributes to it? So I think that is the way of how I have found quite a useful way of framing the problem. Yeah.
Mm. Brilliant. No, I think it's really funny, like you said there, it's that like very similar to actually like I suppose like diagnosing health conditions or things like that. It's actually really looking at that like root cause. So it's kind of like treating your product exactly like you would as treating a medical condition. So like knowing that space and kind of working together with them, I think is so important. And I suppose you obviously your time with Accurx, this is super relevant in terms of like working with medical professionals as well. And I think we, as I suppose, as consumers, we think a lot of the time around like healthcare products as supporting patients. But I think, there's a lot of focus on like supporting, medical professionals. How can we create products that support medical professionals as users? And where do you, I suppose, see the opportunity in supporting them as well to benefit patients?
Yeah, I think this is a very, very good question. And I can definitely sort of reflecting a lot in the last 10 years of like when I start designing for healthcare, like majority of the focus is looking like patient empowerment. But then at the
Mm.
same time, there is another side is like the big organization change or like how they adapt digitals. And then now with Accurx, like looking at designing specifically for healthcare professional. And at the same time, also design for patients. I think what is interesting in this space is looking at like how we can move the two parts together, and which is what I mentioned earlier about the systems is quite fermented and disjoint in many ways. So when you're trying to move one part, what you don't want is like you give the patient the tools, but then there is no facilitations on the healthcare professional side. And
Yeah.
so when you're designing on two sides, you need to understand it's like how you can empower the patient, but then at the same time, actually the factors to contribute to the positive outcome, it comes with like how can we help the health professionals to um, do more and better and then like spend the quality time with the things that is really meaningful for the health outcome itself.
Mm.
So in terms of like what I have been seeing as an opportunity for products to looking at it is understanding how the challenge and the complexities on adapting change in
Yeah.
behavior and culture in health organizations because there's a lot of policies that were designed to protect the vulnerables and also patients. There's a lot of regulations you need to be considered. And then by the time that you introduce any digital product, you probably need to understand where the policy designs comes from. And if you're trying to influence the change, it's not just about the product itself, like it's also other applications around it, be it the policies and the procedure and how it operates. And so I think so far I have seen in my current jobs in Accurx, but also like my times in Bernardo's and also the time that I work on a couple of projects for the NHS Digitals, I can see a lot of them actually the main contributor to changing the workforce of how they work. The product itself is the enabler, like is an
Mhm.
enabler for change. But what we need to understand is like the culture and the process around it, because without that, you won't see how the product is going to be successful. Um, so that's why I think like in many ways, I can definitely relate to that in my past if I'm feeling sometimes frustrated of like not seeing the outcome that we would like to see or in the pace that we would like to see. But I think when you're looking at the scope of the work that actually how you create the success of your product is come down to the other aspect and the applications comes around it so that you can consider those actually they're part of the scope. They are not
Mm.
the obstacle of like contribution to failure of the product, which they are in some way.
Yeah.
But I think it's like in order to understand like, okay, how can I create an environment for the product to be successful? You need to understand the environment first. So I think that's probably something very, very important when you're designing things for healthcare professionals to support them to their day-to-day job. You really have to understand like what is their day-to-day job like, and then
Mm,
the decision-making process of like why they work in certain ways. I think in many ways you can look at it is that is the procedure and the policy design around the healthcare space. But then there's
yeah,
another thing is like how they have been trained. And so I think that's one point that I mentioned in the meetup. I find it really interesting that I have seen many organizations in Europe, but also in the US, is fascinating to looking at like how they can train the future workforce of healthcare
yeah,
professionals, like how they can apply and include and consider digital can play a part. I think if we're looking at like medical educations, like how they can change and evolve alongside with it, I think the results will be better.
mm.
So yeah.
So that solution really starts by making change earlier on to really help educate like medical professionals in terms of the digital space as well. So not just, I mean, like you said, it must be very difficult, I think, when you've got like a culture and a way of working in such big organizations like the NHS, for example, to then bring in new ways of working and to get them kind of like easily adopted. So
Yeah.
that is obviously a space which you kind of have to work with at the moment, but the aim is to really change that space by digging into the root cause of like, okay, this is how we need to train people to then like uh, be able to adapt to those products better and see the value of them when they're kind of launched.
Yeah, absolutely. I think like even like being in this industry for like looking back to how far we have come along, what I find it fascinating is you start to see a lot of more conversations about digitals in
Mm,
in public health. I think sometimes it's easy to looking at like start up and scale up operate in a much faster space, and then
yeah,
at the same time you're looking at it, the consumer demand and all of that, all the innovations and all of that happening really quickly. But then if you're looking at the healthcare professional side, like if you're looking at like conferences and events organized by the NHS, you start to see like all the different like potential, like all these discussions around like how healthcare professional also become advisor to some of these companies to they are the people who understand how the system work. And I think that's definitely going to be really interesting to see how this expertise and diversity of views to bring in to see like how when we creating like product and services aim for the workforce, it doesn't feel like too sort of
yeah,
distant from the reality, but actually like small ideas and product and services they can apply in day to day. So all this
yeah.
will be really, really interesting to see in the coming years.
Nice. And so I suppose we've kind of touched on it there, but I suppose digital products, have moved very quickly, and I think there's a lot of kind of digital startups, a bit like a big investment in that space lately. So how do we ensure that I suppose digital products are held to like the same scientific standards as other health like interventions like medication?
Yeah, this is a really, really interesting questions. And I think I might start with thinking about like what we shouldn't replicate the problem for the pharmaceuticals and the drug
Yeah,
industry. Like if you're thinking about like how clinical trials being conducted and how some of these like drug being tested and all of that, there is a problems about the data itself, or like for example, looking at how some of the drug tests majority is certain demographic and gender. And I think as digital health we should be thinking about like looking at how the system was created, what are the issues in that system already, even though we hold them very high up in terms of like credibilities and all that. I think there is certain area that we need to be considered, like not replicated problem that they have created. So I think like in terms of the access on like what is good data, like what are the standard we hold ourselves to be credible and have authorities around. I think that aspect needs to be considered first. So but then at the same time, I guess I have seen in the last few years, and also some of the other panel also mentions in the event is different countries try to explore different models. So, for example, in Germany, the government trying to put system in place to create the bodies of like trusted voice to looking at digital product, how they can be considered giving like certificates or recognitions on the trusted product, and it tried it in different ways as well. So I think what interesting is around what is the trusted voice and who are these people to make the decisions? And I think in different countries, trying to explore what is that model is going to look like. I don't actually have an answer for it yet because I think we have seen um, sometimes is the trusted voice become too medical and not able to understand the digital side. But then at the same time, is who is the trusted voice come from? Is it the government or like will this trusted voice coming from the private sector? So I think it's quite an interesting space to consider like what is trusted voice means and look like, where the incentive of like driving these um sort of commitment of like in order to get my product certified, like where's the incentives come from? So I think one of the speakers from the panel mentioned about Germany actually quite incentivized like company actually invest and then to be recognized as a trusted product. Um, it will be interesting to see how UK is looking at this. Like, what does that look like in the UK? And then at the same time, like, is it the role that NHS is playing or someone else is going to play? So I don't actually have a specific view or answer for these questions, but I guess like what is important is thinking about like we're not replicating the problem that we have seen from the pharmaceutical side and then actually learn from it and see like okay what is this trustworthy and how we can create it so that people can trust the product that they're using.
That was really interesting as well. I hadn't heard of what kind of Germany were trialing there as well until till the evening. Can you remember what that was called?
Yeah, I can't remember what is that
No,
called, so I
we'll
think we
have
probably I think it's Sonia mentioned that, so like yeah.
Yeah, we'll have to find out and share that with everyone because that was kind of news to me and yeah, really interesting I think to kind of take a look at. So
Yeah.
okay, and it's I suppose in terms of then we're focusing on creating scientific products and products which are backed by science. We have like some good kind of processes around them, but we also really want them to be like user friendly, really delightful products. So how do we I suppose, bridge the gap and what's the main considerations we need to look at between having something which is, really scientifically backed and really going to, I suppose, have that kind of like medical kind of part to it, but then also having a product, sorry, where you want to use it, you really enjoy using it. How can we bridge that?
Yeah, I think I can share it as a designer perspective. I think when
Yeah,
you're designing for healthcare, it's all about context. Like, what is the context you're designing for? What is the message that your design is trying to deliver? And I think I will bring one of my previous work examples, like LV. Like, if we're looking at women's health, like that perspective, like how can you the changing the dialogue and like thinking from that perspective is quite fundamental of thinking about like oh, it's not just about pink and purple or from that perspective of like designing for women, like it can be
yeah,
different. So I think the context about what is the main drive, what is the narrative, like what are the conversations you as a product want to have a conversations with your user, like that context is going to be very important. I thought headspace is also very interesting to like thinking about how we're talking about mental health. And I mentioned about these examples when I was on the panel that night to talking about like 15 years ago, if you're thinking about you might experience anxieties and if you go into the GP, you were given a sort of black and white form paper A4 and then in the clinic they will give it to you and then you do your personal assessments with like lots of questions like rate 1 to 10, how do you experience that, does it happen every day, like is it's actually a very sort of intimidating, but at the same time, you going through that process yourself, going through that question, asking yourself, like all of that, and then giving back to your GP, and then they look at it later. But now, if you're looking at like Headspace, what they're looking at is like changing the dialogue, making people talking about mental health in a much more accessible language. It kind of playful. Obviously, like the intent of what the GP assessment is going to do and Headspace are completely different. But I think what is useful is to consider like why you want to start that conversations. And I thought Headspace gave this really interesting angle on like you can actually listen to a medication and meditations during your commute and you don't have to hide at the corner to do that and you can actually talk to your friends about it as well, and in many companies they will have like a company subscriptions to provide to the employees to talk about mental health. And so I thought like this is quite an interesting perspective you're thinking about it as a designer. It's like you suddenly change the dynamic of like how one talking about mental health in a much more accessible way than the others of like black and white, sort of like self-assessments, and then the kind of the conversation is completely changing. So I guess thinking about back to your question is all about the context, like why are you having that conversation in the first place? What are you trying to achieve? And as a designer, you were thinking about in what way will be the most easy and engaging way to have that conversations with your user, because what you don't want is someone actually experience quite a sort of serious mental health issues and the playful manner might not be relevant to them. And so
Yeah.
what you're trying to do is like really understanding what is the user need and then curating the space that your product can have a connections and the relationship builds with the user.
Yeah, exactly. And I think that's a really interesting point in terms of like where does your product sit within that? It's more around you look at like Headspace, for example, it's like facilitating those conversations, making it more of like a day to day rather than like a kind of final point of where you need support is that kind of prevention side.
Yeah.
Which is then kind of leads to then being able to, I suppose, be able to deal with those more formal kind of processes when it comes to that point because they still have their place.
Yes.
Um, so in terms of, I suppose, when we look at AI, and this was kind of a big conversation on the evening, I feel like
Yes.
this could have been a whole topic in itself around AI in the health space. But how can we use generative AI to like enhance digital experiences and where I suppose while still maintaining the human aspect of that? Because I think again, as people discussing, your health, I think it's so important to understand, like you've been such an advocate for throughout the whole panel, that person being that individual and being that, person as well, and understanding that person, rather than just generalizing. So how can we use AI to benefit digital health?
Yeah. Personally, I didn't work on many AI product, but I think like in terms of my view on AI and generally about like digital product, I think when when we work in the space of healthcare, when we design like digital products, I think one thing we need to recognize is about digital literacies. And I think we
Mm,
are not having enough conversations around digital literacies. If you're looking at the public health data, many individuals who are the vulnerable people who actually need the better health outcomes, like they're the people who actually need to get better understanding on the health literacies. So if we're looking at the facilitations is delivered by digital product, which is a channel and a product that they don't have a lot of literacy around it. So we actually got two issues like trying to overcome at the same time. One
yeah.
is you're trying to give people more around the health literacies, they can better managing their health outcomes and routine, etc. But then at the same time, we are operating on a space that they don't have a lot of understanding on, or they don't even have access to, like be it smartphones or internet data. So that on its own, unintentionally, we are excluding some certain peoples already. So in
Mm,
the questions of AI, I think it's exactly on the same bucket of the problems we are operating in is data literacy. Like how much people understand AI, and then at the same time, like where these informations come from, because AI is also being designed as well. Like how can we inform an AI that consider the diversity of the peoples that we are actually servicing, and then at the same time, like how much of the trust individual can have with this data. So I think
mm,
all of these will come into play, like in the context of AI, but more generally about like digital health product as well, is the literacies around like three areas. We're not just thinking about health literacy because there's other aspect if we're thinking about how quickly the space of like digital product have moved on from digital literacies and health literacy. We're almost carrying these issues like going to another space, but at the same time making sure that we don't forget about vulnerable communities and individuals who actually A, do not have access to it, and then B is do not have the understandings on like how this information being designed, is it actually for them? And then at the same time is can they trust the data? And I think when we're designing for AI and digital product, you cannot not talking about trust. Like trust is such an important thing. And I think we talk a lot about individuals when they seek for healthcare, how much they trust the doctors. So suddenly we have new players come into facilitating their health and care. then how much individual can trust A, the digital product, B, is the information being servicing form. So I think from a design perspective, it's like really understand like what trust means and look like for different individuals. And then at the same time is the literacy side on like, do they actually understand like how certain product and information present in certain way?
Yeah, exactly. I think like trust was a very common theme at the panel. I think we heard a lot about that topic for sure. So, I mean, the big question and the reason why we kind of, hosted the evening was to discuss what is more powerful, medication or digital product.
Yeah, that was quite an interesting question, and it was also interesting from the perspective on like how many also start talking about how they can see the both coming together, and I also share a very similar views about that, and I remember I used that line in the event, like it's not digital health, like it's health in the digital age. I think that's kind of this sentence kind of um sort of building up my view on this aspect is it isn't just about digital health, it's health in the digital age. And I think it's as a designer, I don't see, or maybe like that's probably my personal view. Like I won't compare the two together as like two different things. I will consider how both of them working together. And I have seen is again back to the point I mentioned earlier about it's about context. So if we're looking at say like diabetes, for example, like we know that like in order to achieve the health outcomes, people need to take their medications. But at the same time, it's also the lifestyle change. And I think the two things needs to work together. You can't just say like, oh, take the medication, forget about the lifestyles. Or in some cases, some of the diabetes patients, they really need the medications. And so I think like on the two things comes together, it's very important. What's interesting is also many talk about some of the example about weight loss as well, or like some people they were very much like engaged with the medications and also the routine changes, but once it stopped, they bounce back. And I think is that like engagement on understanding like are we able to achieve the behavior change, but then at the same time the behavior change comes in two ways. One is the adherence of the medications, but then at the same time it's the lifestyle changes. And I guess on a slightly less sort of medical side, if we're looking at NHS data, all these years, like so many illness and disease like can be prevented, and that is related to lifestyle changes. So I guess like again, going back to the point of like designing for the context, like do people actually understand the health outcome? Do people understand the benefits along like adopting a new behavior and lifestyle changes and the outcome, what is that means and look like for them. And so I think the two things actually work hand in hand together instead of like one will be overpowering the other one.
Yeah, yeah, exactly. And I suppose to kind of round us up, I mean, how do you imagine like the future of healthcare, where I suppose digital products and medications are working asynchronously? And I think you kind of touched on it in that last question. But where do you say that kind of future? Where's your, I suppose, ambition and what you would like to see?
Yeah, I talk quite passionately about it in in the panel that night. I think working in this space for 10 years, I'm loving this industry. I find it like really, really interesting. I read, I really hope that we can start shifting the dynamics to talking about preventive healthcare.
Mm,
I think being a designer looking at the healthcare system from different perspectives, from the government perspective of pharmaceuticals and scale up, and now being a service provider to the NHS, I think what I'm seeing is like a huge opportunities around like changing the dialogue about healthcare is something that I'm really excited about. And I'm hoping like we start to talk more about that because of the potentials that we have seen on how accessible digital can make health conversations changing into a daily conversation talking about lifestyle change. And I hope we can see ourselves slowly and gradually moving away from healthcare as a ill health system, but much more about a daily conversations on like living a more healthy lifestyle and habits. I think that is very important. The other aspect I also start to see, particular my time in Bernardo's, I have seen very interesting is like what are the roles other stakeholders in the whole society ecosystem play? Like be it the climate and education. I think earlier I mentioned about we haven't talked a lot about digital literacies and then health literacies. And I think when I'm looking at numbers of product that I've been working on, when the users start to talking about health, it's already too late, be it
Yeah.
mental health or other aspect. And then if you are going to like a very service designer or product designer approach, like you map out the touch point, actually the touch point that really changed the user perspective is back in like family, schools, educations and all of that. I think what I'm seeing, it could be really interesting, and we definitely start seeing it, is like how other players looking at healthcare and play a part into it, be it applications, be it families, looking at like the wider ecosystems. I think that is something that I'm really excited and start to see like pockets of different companies start to approach into this way,
Mm.
beyond just talking about like patients as a patient, but we talk more systematically about the society, and even including climate, not just about people as well. So that's all exciting. In terms of the obstacle as we're moving forward, I think integration, I think this is going to be a huge part. I think right now, um, as I'm working on like different parts, I can see like how the systems and all the different part works together is still a huge obstacles on like how we can get better in like sharing data or building a much more holistic views about what is a good healthcare should look like, could look like. I think we haven't quite get there yet. So all of this will be a very interesting place to be in right now that we can have these conversations. And I guess like for those who are listening to this podcast, your interests or like want to get into healthcare, there's so much scope that you can play around from different perspective. And I guess for startup as well, you can really looking at healthcare into within the system, but also outside the system.
Yeah, exactly. And I think, what I was just going to mention is I think the appetite from yourself, Filipos, Erin, Sonia to like continue this conversation for people who are looking to, join healthcare, people who are in healthcare at the moment. So if anyone has any questions off the back of, our podcast, obviously this is a huge topic, which we've managed to combine into a 30-minute podcast, which is,
Yeah.
it's a big task. So there's
Yeah.
going to be so many more questions which we want to hear from like the community around. We want to continue that conversation. So if anyone has any specific questions they want to ask, or even comments or observations themselves that will facilitate a conversation, I think that's the whole point of this, is to bring those conversations together about the health space and continue to kind of move things forward. So Veron, thank you so much. It's been yeah, so lovely to have you on the podcast, to kind of continue your conversation from the panel. Just as a ending question, we ask everyone on the podcast one question, which is really to facilitate like our members to continue to be inspired by product, to continue to connect with people. So, who is inspiring you in the product space currently? And I suppose who would you suggest our members be aware of, start following? Anyone who you would kind of point them in the right direction of?
Yeah, I actually quite like to look for individuals who are not in product peoples to look for inspiration, because I also find it quite interesting to gain different perspective outside. There are two peoples that I thought about, particular for this conversation. I find it quite helpful. The first one is an author called Warren Burgess. He is a journalist, and then he wrote books about asking beautiful questions. And I find it's really interesting, particularly myself, background as a service designer as well. When you are working on such a complex, like systematic problems, I think often like your design opportunity is how you ask the questions.
Mm.
Because asking the good questions, asking the beautiful questions can inspire you to spark different innovations. And I think that is a quite a useful book, and I really follow like his articles and books talking about the technique of asking beautiful questions. The other one is a organization psychologist, who is also a professor in university in the US, called Adam Grant. He specialized into organizations, cultures, and behavior change of like how people respond to change. And I think that's really relate to my time working in the space of healthcare. I don't know for those who working in this space for quite a long time, some of you might be feel frustrated about like how slowly things take, and then sometimes we feel very frustrated with the red tape. And I think having perspective about understanding how organization is so difficult, it's like where is that push coming from? Like very often isn't just the product. Like you really have to understand how the system works. So I find like reading books and like getting inspiration from like understanding change at scale. Adam got some really interesting insights. So these are the two people in the context of this conversation I find particularly helpful.
They are brilliant recommendations, and yeah, asking beautiful questions. I'm just really intrigued by the title of that already. I really want to read that, so I'll selfishly be putting that on my reading list as well. Um, but no, thank you so much, Ron. Honestly, it's been a great conversation. It's so important for, I think, people like yourself who have so much experience working in the health space to kind of give back. So we really appreciate it. And like I've said, to anyone who's listening, anyone who joined us on our meetup and want to continue that conversation, want to ask questions, please reach out to us and we'll continue those conversations.